5 minutes after 11 o'clock. Thank you for tuning in this beautiful Thursday morning. Brittney Marthaller is in the studio. Brittney brings us some really great guests. Brittney is with Ocala Health. She's the communications manager over there, and she has brought to us today David Parent, who's a registered nurse and oversees patient care on the Women's Health Unit, I think is what it says here. All right, do I have that right? At Ocala Regional. And are we expecting Dr. Paquette or no?
I am not sure if she's going to be able to join us this morning.
Okay,
so.
All right. Well, good morning.
Good morning
to both of you. Thank you for coming in here. So are we going to be able to talk about women's health? Just two guys? I mean, is this going to be possible?
We'll take a stab.
It's one of my most comfortable topics, by the way, is women's health. I'm teasing.
We like to do that to you every once in a while.
I know. I said that to
Robin.
I said that to
couldn't
Robin.
wait.
I said, please be in the studio when we talk about this. Well, thank you for being here. Do the work you do, is it sometimes preventative? Is that
in the hospital? Many times it's surgical.
It's always surgical.
Many times it is.
Okay, and like what kind of surgery is typical? Will you be? Are you a surgeon?
No, I'm not with the surgeon.
Okay.
I'm the one who is in charge of the nursing care and the patient care.
Okay.
While on the women's unit at Ocala Health.
And the surgery is usually
hysterectomies.
Okay.
Either laparoscopic or open hysterectomies. We do surgical interventions for bladder repairs, urinary repairs as well. Usually the women have been to their physician, tried conservative treatments, and now is the time that they need surgical repair.
And I'm guessing the doctor determines that. The woman
Correct.
doesn't determine that herself, right?
The doctor does, yes.
So the difference between laparoscopic and open, it sounds like you'd prefer laparoscopic, I'm guessing, for probably a couple of reasons. One is
most times laparoscopic surgery is easier on the patient. The recovery time is faster as well, depending on the condition of the patient or what they're going into surgery for determines whether or not they can do laparoscopic versus an open. Different patients have different conditions.
If the age of the woman is very young, and in other words, maybe she hasn't had children yet, is there anything that can be done so that she will have children? Is that going to be a part of it? Do you know what I'm asking?
No,
I'm guessing that this would be the concern of a woman going in for surgery, that she might come out of surgery with no longer the ability to have children. Is there a way to?
Most times that's where many of these surgeries are. Most of my women have had their families already. They're having pain around their reproductive organs, either from pelvic inflammatory disease, endometriosis, uterine fibroids. They've already had their families, and they're just not wanting to live with the discomfort of what their conditions are.
How do you help them emotionally? Because when a woman has to go through that and not be able to have children again, even though she is older, there's something psychological about that.
My staff are phenomenal. I'll just say it right out. Right. I have a smaller unit. My unit is only 5 beds. It's a very spacious private room. We encourage the spouse to stay with the patient as well. We're able to give more intimate care for the woman.
Oh, that's a really good idea, to allow the spouse to stay.
Yes. Yeah.
Okay. So I guess my question about the younger, older woman, it's most of your patients are older. So does a hysterectomy, what am I trying to say here?
Hysterectomy.
Thank you. Does it always end up with the inability to have children?
Correct.
Okay.
Yes.
I hope that wasn't too dumb of a question. I just wasn't sure.
No, not at all.
Okay.
With the hysterectomy,
does it affect?
All of my women have already had. They've almost all have already had their families.
Yeah, I got that.
All of my women.
I know. I'll use that.
All of my
one day.
All of my patients are my family.
In a movie, I'll say that. Not in my real life. All right. So aside from that, what about what do we produce down there? We produce hormones. Hormones. Yeah. All right. So what about
Estrogen.
that? Yeah, that part. I mean, the part that...
Hysterectomies don't always take the ovaries. The ovaries are where the hormones come out, where you have regulators for estrogen and that sort. Basically with a hysterectomy, if you think of having a baby, you're taking the basket.
Uh-huh.
So you're not taking the reproductive organs, you're taking the ability to carry.
Oh, okay. Okay. So,
if that makes sense.
So whatever. So you know what I don't like about this whole science is that I am a byproduct of chemicals. Like, this whole Bruce Jenner thing, like he takes different chemicals. He's now Caitlyn.
Yeah.
Right?
Caitlyn wouldn't be on the women's unit. Caitlyn is not still doesn't meet the criteria for the women's unit.
But I guess I'm trying to be serious, but it's hard to with that. But if you took away the balance of testosterone and estrogen, from the way I understand it, both men and women have both, but women have more estrogen and we have more testosterone, right?
Correct.
So I'm actually at the mercy of that. If something gets out of balance, suddenly I don't have any facial hair and things change on me, right?
Correct.
And so when you do surgery on a woman and that suddenly changes, but you say that doesn't change, right?
Depending on the surgery, many times it will not change.
Okay.
When the basket is removed, do the ovaries then dry up by themselves? Or are they still there producing that estrogen and stuff?
They will reabsorb. Whatever.
Oh.
They continue to produce estrogen. They continue to help with hormone regulation.
Uh-huh.
They function normally. They just don't have the monthly cycles with egg production.
So why do they need the hysterectomy? Is it
for a variety
cancer?
of reasons? There can be cancer.
Okay.
Many times there's uterine fibroids. Uterine fibroids they're benign growths, but they can become large. Press on the bladder, press on the pelvic wall, press on the colon, giving a woman an overall sense of discomfort, pain, especially around times of menstruation. Mm-hmm. So they become more of a hindrance to her life than anything else. These fibroids are...
You have a really soft-spoken way about you.
Good demeanor.
That's probably why he's in the women's world, right?
I guess so.
I mean, they must really like that. I mean, they wouldn't want me. I would be too loud. Is something not loud enough?
No, you're fine.
Oh, okay.
I haven't been kicked out of a room yet, so I guess I'm doing something right.
Oh, good.
Well, when you are, when the women come to you, it's because they've already seen their doctor and they know what's going to happen and everything. But they do need some kind of reassurance because they're always saying in their mind, what if? And when you're speaking about older women, older could mean like in their 40s, right? Not necessarily their 50s or 60s when this kind of operation has to take place.
It can take place, yes, 40s and beyond. There are other reasons for getting a hysterectomy or for getting any other of the surgeries that we do there.
How long are they typically with you? How long do they stay?
For an open hysterectomy, they're usually 2 days post-op. So the first day is the surgery day, so 2 days after that.
Okay, we're up against the break, so let's take that break. David Parent is in the studio with Brittney Marthaller. We are talking about women's health issues, specifically surgical issues, it sounds like, and reproductive surgical issues, to be more specific. We'll expand that a little bit when we come back. And if you have any questions, feel free to call. The number is 622-9622-622-WOCA. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. For today, partly sunny with an afternoon and evening thunderstorm around, the high 88 to 92. Partly cloudy and warm overnight, low 74 to 78. For tomorrow, sunshine mixing with clouds with a couple of thunderstorms around during the midday and afternoon hours, high 88 to 92. And for Friday, more clouds and sun with a thunderstorm or two likely, high 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Get it for less at the DIY Home Center outlet. Get top quality real wood cabinets the same or less than the big box stores are selling the cheap stuff. And that's not all. Drywall screws big box stores are $6.47 a pound. At DIY, only $4.99. Plus, DIY has the largest selection of mobile home parts and accessories anywhere. From carpet to doors, get the DIY supplies you need for less. The DIY Home Center outlet. We are your building material closeout store. 2191 Northwest 10th Street, just 2 miles east of I-75.
Come join New Mail Medical for their town hall at Golden Corral in the Villages on Wedgwood Lane, Tuesday, July 21st and Wednesday, July 22nd from 4 to 6 p.m. Join renowned expert Dr. Christopher Asandra and get your questions answered. He will be discussing the importance of hormonal replacements and common misconceptions for men and women, as well as the importance of sexual health and anti-aging. Now, dinner and refreshments will be provided for those in attendance, along with door raffles and giveaways. But seating is limited, so please call today to reserve your space at the Golden Corral in the Villages on Wedgwood Lane. Call today, 404-4779. That's 404-4779. One more time, 404-4779. And make plans to join New Mail Medical.
Here's what you may have missed on the John Tesh Radio Show.
Coloring helps our brain downshift to more soothing alpha waves. That's because filling in the lines requires just enough concentration to keep your brain focused without risking any burnout. Lower testosterone means a man is less likely to stray and look for other mates after he becomes a father. Are your lips always dry or chapped? That is usually the first sign of dehydration.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
Right here in the middle of the summer, it's time to talk some football. Follow me to Hoover, Alabama for SEC Media Days, made possible by the Briggs Law Firm, by HDG Hotels, and our thanks to Ocala Copy Center. It's football time, Hoover, Alabama, SEC Media Days.
The most trusted name in news, Fox News, every half hour, only on 96.3 FM, 1370 AM, The Source.
WOCA. All right, 18 minutes after 11 o'clock. Let's return to David Parent in the studio with Brittney Marthaller. Brittney, of course, from Ocala Health, as is David Parent, actually from Ocala Regional Medical Center. We're talking about what David does as a registered nurse overseeing patient care on the women's unit at Ocala Regional. So I'm guessing that a big part of what you do has to be answering questions. I'm guessing they have lots of questions after surgery.
Yes. Everyone has questions.
So you're constantly educating. Is that right?
I will do some education, although my staff is proficient in that.
Okay.
Some of my staff members have been doing GYN patient care for up to 20 years.
How do you have a new member come on board on your staff if they want to work with you? What qualities do you look for in them?
You look for the experience of working with surgical patients, but more so I bring them in and have them work with my staff, and I trust my staff's judgment how he or she is working out. I talk to my patients and I see how the nurse is working out. Like I said, it's a lot more of an intimate relationship on my women's unit, so I can gauge how somebody's going to be a lot quicker.
Yeah, it's a big team effort. I mean, really with all of our staff, but women's it's such an intimate team.
Right.
So it makes a big difference that how well they work together.
And then what is your role in this, Brittney, as part of the administrative side with the actual hands-on people? Are you constantly going down there seeing David or having meetings with him and his equals, or how does that work?
I like to, just visit with patients just to see how everything's going, just, for my knowledge in general, just to know. But a lot of my role comes into play early on, as we often talk about doing the seminars, or I'll speak with, women at health fairs and things that we're doing to help get them, if they don't have a GYN or if they don't have a primary even, help get them set in the right direction. Because when I'm talking to attendees at different events that we have, they're often they've got tons of questions. They're even more scared, and so we'll bring community physicians, community healthcare providers out to speak about different conditions, what can be done non-surgical, and if a surgical intervention is needed, what are the next steps? Where do you go? Right. So that's my passion in it, is that initial I just love speaking with someone who says, thank you for bringing this presentation to us, because I've been having this issue for a long time. I didn't know there was anything that could be done about it, surgical or non-surgical.
Really?
So that's
wow. So let's speak to that lady who's listening right now. What might they be experiencing that they never knew there was a fix for?
There's a number of things. As he was mentioning the endometriosis, the uterine fibroids, just things that there's generally pain associated with, and sometimes people don't, if it's something with the urinary tract infections that keep coming back. There's a lot of things that marry in between your urinary system and your reproductive system. So there's a lot of concerns, and just I think because it is such a sensitive topic sometimes. We often have intimate groups at these types of seminars and things that we do because they are very nervous to say what exactly it is that they're experiencing.
And is that because we all fear the worst news? I mean, I think this is probably true for all humans. We feel a little pain. It's, oh gosh, I don't want to see a doctor. I don't want to hear the bad news. Do we do that?
And it could be, possibly embarrassing. A lot of people are very private people, and they don't necessarily want to come out in a seminar type setting and say, I've been having, this.
Really?
What is it?
Really?
But some people have no issue with that, and other people in the audience appreciate that, appreciate them asking certain questions.
That would make sense.
So,
yeah,
absolutely.
Yeah.
Usually the biggest stress patients have who come through the emergency room, they've been having a lot of pain, they've been having a lot of urinary infections. They come to the emergency room because they've been trying to deal with it on their own or just live with it. But they've gotten to a point that they can't, and then they go to the emergency room, and then they wind up on the women's unit, and they don't have a GYN doctor, and they're not sure where to turn, and so they're doing things almost out of their control because it's gotten so far, and they're not sure what's going to happen. And that's when excuse me, that's when it takes more time for my staff, myself, the physician, to reassure the patient that it's not as bad as it is. We can work through it, but when you're going at that late hour, then things move faster, and it takes a lot of control away from the woman, and it's a lot more stressful for them, especially if they have busy lives, busy families, work. So being laid up in the hospital is a tremendous stress on them.
Wow.
And then when they come there and they don't have a GYN, after the surgery is done, you'll be able to recommend somebody for them so they can do a follow-up and then get their annual pap smear and mammogram and stuff like that?
Well, my surgical patients most always have a GYN doctor beforehand, and they're the ones who schedule the surgeries. Many times when patients come through the emergency room, we also get medical patients that come up. Either they come in with abdominal pain, they're thinking it's their belly. It turns out an ultrasound shows that it's an issue with their uterus or bladder or that sort of thing. Then they come up to me and my unit. Those patients, they're assigned a GYN physician at that time, and then that physician starts the process of history taking, information gathering, talking with the patient to see what the best course of action is for her at that time.
Okay, yeah, because what surprised me earlier, I guess I understand it better now, but it surprised me that they didn't have a GYN at that point. I would think that would be the first.
No, the surgical patients always have a GYN.
They always do at that point,
yes.
Okay.
The non-surgical ones that come in either from their primary doctor or the emergency room because of pain,
Right.
or discomfort, or urinary infections that have gotten a little out of their unmanageable.
Are there any surprises, like when you have a lady come in for the pain and it's diagnosed and you do the CAT scans or x-rays or whatever you do, once the doctor is operating, is there a chance that there might be a surprise in there that he might have to take care of that too?
Usually with our imaging, with our CAT scans, with our imaging, the physicians have they have a very detailed picture of what's going on with the woman, and if they do surgery, they have a list of things that they've seen in the past that they may address if something is in there at the time. They'll give a list of scenarios to the woman. If we usually there's not a very there aren't very many surprises for them. The physicians the physicians in Ocala are quite experienced. They've been around for quite some time.
It's good. That is always comforting to know. Brittney, you know what I was thinking about? You have the toll-free number that we can all use. And I'm guessing that would be less embarrassing. You're on the phone, they don't see who you are, and you have these questions.
That's absolutely correct.
So, so I guess this is a good time to ask for that number.
Yes, our healthcare referral line and information source is 800-530-1188. And you can also find out information about events that we're having on our website at ocalahealthsystem.com.
And that would include some of those, like, those educational
seminars,
things?
Yes, any educational events.
Is it regular, like once a month, or?
We don't have a regular specifically for women's health, but we do them very frequently. So the calendar's always up to date on there between different locations that we have, including our Senior Wellness Community Center out by On Top of the World. So,
David, do you have any weird requests from the ladies? Like, do they ask you to play Beethoven or something in the room?
Usually they're wondering why a man's walking into their room at night at 8:30 in the morning to see how they're doing, and they wonder, since I'm not their nurse and I'm not their patient care technician and I'm not their doctor, so usually.
Oh my goodness! I would imagine.
Once I walk in and I knock on the door, once I greet and introduce myself, that's fine. But no, they're just. I can't say that I've had anybody who's not been just a wonderful person come through my doors.
Well, that's good to know. And you've been doing it for how long?
At Ocala Health, 1 year.
Okay.
But you've got history going back before that.
I'm just about 20 years as a nurse.
Wow.
Wow, that's a long time. Where did you come here from? Where did you move from?
Canada.
From Canada?
Yes.
Oh.
What part of Canada?
About an hour north of Detroit, Michigan.
Okay, sorry.
Over in Ontario.
That's where they speak English or French? English.
Depending on which part of the country I come from.
Do you speak French?
My French gets worse every year than
really?
There's not a lot of French down here. I get scolded when I go home sometimes.
Well, hopefully we've reached out to somebody who will benefit from the information. If you know somebody who would benefit from this, remember we do videotape these, and you can share the video with anybody. It'll be on WOCA's Facebook page and WOCA's YouTube channel by this afternoon, typically. And Brittney Marthaller, thank you for always bringing us some great guests.
Thank you for having us.
Always good to see you. And David Perrin, thank you so much for what you do.
Thanks for having me.
You are one of the softest spoken guys I think I've ever met.
Great demeanor.
If I had a lady in my life that was in care, I would be glad that you were there.
Well, I'm glad you say that.
Yeah.
It means a lot.
Thank you, David. Thank you, Brittney.
Thank you.
We'll be right back.
Fox News Radio, I'm Pat O'Neill. Day 2 of the